Hi, I've been asked to do a recording on how to access, interpret, and complete your student minimum competency matrix. That is a requirement of program completion here at NCTI. So the first thing that I'm going to have you guys do is it's important to go ahead and run your SMC report so that you have that on hand. So as I go through this, you can kind of pause the video, go back, reference your individual report, and then hopefully this will all make sense. So first thing I'm going to show you all right, so the first thing I'm going to show you is where to actually access your report. So from the FISDAP menu, you're going to go to reports, and then you can hover. As you hover over reports, you'll have these two options, either evals and skill sheets or reports. We're going to go to reports, and you're going to get a list of reports that you have access to run. Now, what you see on the screen is actually all of the instructor reports, but the names are the same. So you're going to want to go down on your report and find the COAMP Student Minimum Competency Matrix, SMC, formerly known as Appendix G, and you're going to click on that. It's going to take a few minutes. Once it loads up, just go ahead and put it off to the side, and then we'll go through it. So once you actually do run the report, you're going to see something that looks pretty much like this. And it's going to say this is the COAMP Student Minimum Competency, or SMC matrix, known as Appendix G. When you run this, you don't need to actually input the dates. It's just going to pull all of your information. So as you kind of go through this, it's important to understand the layout of the actual report. Now, this report is good for any class that is starting before August of this year. In August, we're hopefully going to be under a new type of matrix. The numbers are relatively the same, just the way the report is laid out is a little bit different. So that's only going to apply to classes that start August of 2022 or later. So the first thing to understand about this report is that it's laid out into 4 tables. Table 1, 2, 3, and 4. Depending on where you're at in the program, you may or may not see Table 1 populated. Table 1 will populate as soon as you enter and lock your first clinical or field shift. Prior to that, there's no way for FISDAP to know where to pull this data from. So Table 1 is all of the live patient contacts that you get in clinical and field setting combined. And I'll go over each one of these tables in depth. So Table 1 is your live patients from clinical and field internship. As you scroll down to Table 2, this is going to be all of the competencies that you come across in didactic. So this is all laboratory skills and scenarios that you're going to document. Now, this table gets a little bit more confusing in that it is broken down into 4 subcolumns. So as you look at it, there'll be 4 subcolumns going left to right. So in this first column, this kind of gold column, it says individual student competency evaluation in the laboratory, FISDAP lab practice items. This is basically all of your isolated skills. So every time you do an IV, you go into your quick add skills, you put IV, successfully complete, submit. That's what this column will populate. And so you can see here on the left side of that column are all the minimums that you need to get. And on the right is how many you actually have. Now, it's important to understand that it will not document anything until you have locked that lab shift. Once you've met the competency, it will change to a green color. And that's going to be the goal by the end of the program, is this entire table is green. So anything that's still in red is still deficient. And so you need to work on those. So again, these are all of your isolated skills. Now, one of the things that is often overlooked is that when we went through orientation on the first day class, I talked to you about your peer-to-peer sign-offs and your instructor sign-off, and that you had to have at least 5 peer-to-peer sign-offs before you're eligible to get an instructor sign-off. Once you have those 5, then you can approach a skills instructor, have them evaluate you, and sign you off. This is true for every one of these, with the exception of our oral tracheal intubation for adults and peds. That minimum is 10. So you need to actually do 4 more in order to meet that minimum competency. So as you go through this, it'll turn all green. And this goes down for about a page and a half when you actually print it out. So looking now at the second column, this kind of blue column, this is going to be, again, it's still individual competency, but anytime you see the word scenario, I want you to think of that as PCR. So you need to do a PCR. And this is for all lab patients that are set up in a formative scenario. So I want you to keep that in mind, formative, because I'm going to talk about that later. So again, on the left side of this column, you have the minimums. And on the right is how many you've actually documented. Once you've documented the minimum number, it'll change from red to green. All right. And again, this kind of goes all the way down. One of the common ones that a lot of students have difficulty doing is getting these 2 right here. And it's the comprehensive normal physical assessment for the pediatric patient. The way to get that to populate is in a lab scenario, which means PCR, you need to do under impressions, where you have the drop-down menus for primary and secondary impression. For primary impression, you need to put healthy screening and physical, right? And once you do that, you lock that patient, lock that shift, it will then populate those. So you need to have 2 of those, but that seems to always be one that's commonly been an issue. This third column, this one that's kind of this light green, is lab skills that you did where it involved a live patient. Now, usually the only live patients that we do in the laboratory setting is when we utilize students as patients. And that's usually not a problem. The one issue is doing the pediatric assessment. We don't routinely bring in children into the laboratory setting and practice on them. So in this case, you guys can use a student, and that student just happens to be a pediatric patient, simulated age. And then once you do that, you put that age in there, this will populate. But remember, it has to be a live patient, which means you need to actually click live patient on the PCR. And then this last one, this kind of, I don't know, pink-ish color, this is really just putting it all together. So again, we've got scenario, which means PCR. This can be on a live patient. This can be on a simulated patient. And these can be any patients that you get in clinical or field. So it's really that catch-all. Our goal is to have you have table 2 100% complete before you go to the field, so you don't even have to worry about it. Now, the difference between this column 4 and column 2 is, remember, we said column 2 was formative. Well, column 4 is what's called summative. And when you open up a lab PCR, and this only applies to lab PCRs, but when you open up that lab PCR, the very top left-hand corner, you'll have an option. It'll say formative or summative scenario. By default, FISDAP will make all lab PCRs formative. So in order to get table 4 to populate, you actually have to click on summative scenario, and then it'll make that a summative scenario. And so you can kind of go down through here. Again, on the left-hand side is the minimums that you need to get. On the right hand is what you've actually documented. Once you meet the minimum, it will turn green. I do want you to know that all of the advanced airway techniques or tracheal intubation in both adult and ped and supraglottic airways, which include LMAs, king tubes, and iGels. You need to have 12 of each one of those in a summative scenario, which means you actually have to complete team lead in that scenario, document a PCR, and indicate that you performed some form of advanced airway. And so you can kind of scroll down through here and see that. There are 15 IVs that you have to document in a summative scenario. So it's a real good idea to go through and familiarize yourself with these numbers. I want you guys to run this report on yourself every week to make sure that as you're documenting skills and locking those shifts, that you're actually getting credit for it. Moving down to table 3. Table 3 is divided into 2 main groups. You've got scenarios, again, which means PCR. Scenarios where you were the team leader, and scenarios where you were not the team leader, you were just a second set of hands. What you'll notice is that there are no requirements for you to be a team member. The only thing that we're tracking is you as team leader. So there's a box on that PCR that says, I was the team leader. You need to make sure that you click on that box. And as you do, these things will start to populate. Now, there's not a whole lot of requirements in these, but as you can see, you need to have 1 pediatric abdominal pain, 1 adult diabetic issue, 1 geriatric sepsis, okay? So as you go through those and you meet those competencies, they will go from red to green. There is a bug in this that I do want to mention because it seems to always throw students for a little bit of a loop. This bottom bar down here, no matter what you do, will always remain red. So just ignore it, it doesn't matter, okay? So table 3 is team leads. Table 4, again, just like table 3, is broken up into 2 segments. You've got your individual skills, which are your quick add skills. This will start to populate pretty quickly as you go through didactic. And then the second column, again, scenario means PCR. So these are skills that you document as part of a PCR. So you can see most of these are BLS skills, splinting, hemorrhage control, glucometer, CPR, et cetera. All right. So on the left-hand side of each one of these columns, you have the minimums. On the right, where you can see mostly is red right now, is what you've documented. So again, it's real important that you run the report on this weekly so that you can keep track of this. As you progress through each of the 3 phases in this program, you will hear myself and the coordinators tell you multiple times that you are responsible for monitoring your own progress. Doesn't mean that we're not going to look at it. It just means that there's 150 students in this program at any given time, and we're not going to be as up to date with your progress as you are. So please make sure you're running this SMC report at least weekly. Okay, so that's just a brief overview of the layout of this SMC report. You know how to run it. The other thing that I want to show you is the quick reference guide that FISDAP put out that goes along with it. So where do you find the quick reference guide? You find it within the course webpage. It's found under the NCTI document. So when you click on that, you're going to scroll down in this first kind of group of documents to where it says Appendix G Quick Reference Guide. And when you click on it, it will automatically open this up. You also have the option of saving it as a PDF. This document's about 19 pages long. I think it's a great reference to save and just put on your phone so that you always have it available. So let's say that we'll go back to that pediatric patient from column 2 in table 1. I'm sorry, table 2. So this one is always difficult to get. So how do I know what, as a student, how do I know what I need to click on in order to get this to populate? Well, this quick reference guide will tell you that. And so it breaks it down. Let me make this a little bit bigger so it's easier to see. It's broken down by tables. So here you've got table 1 and everything you need to click on in order to get that to populate. So specifically, since we were talking about the comprehensive normal physical assessment in the pediatric from column 2 of table 2. And so here's what you need to do. You need to click on the box, I perform the patient exam. And healthy screening and physical as the primary impression on a patient that's less than 18 years old in a locked lab shift. Okay, so that's what's important and how you'll get that to actually populate. Same thing, if we go down to, let's say, nasotracheal intubation. If it's in a formative scenario from column 2 of table 2, airway intervention performed needs to be clicked on when you click on the skill, and you need to click on nasotracheal intubation in a patient that's less than 18 years old in a, I'm sorry, greater than 18 years old in a locked lab shift. Okay, so again, I would go through this document, have it readily available to you so that you can go through it. Other than that, it's pretty easy to navigate once you get into it. It's not as daunting or confusing as it seems. This quick reference guide will save you a lot of time in figuring stuff out. Now, the problem with locking shifts is that once you lock them, you don't have the ability to unlock that shift and get back into it. So you'll need to reach out to either your instructor, the field and clinical coordinator, or myself, and we all have access to unlock that shift. Now, I don't mind unlocking shifts, but if you don't complete your documentation in 72 hours and FISDAP locks it, and it will, and I'm constantly unlocking shifts that you didn't finish in time, I'm probably not going to unlock those shifts for very long. I get it, sometimes stuff happens, internet access tends to drop, but it does take us quite a bit of time to go in and unlock shifts. It's not as easy as it should be. So if you need a shift unlocked that you locked, not a problem, reach out to the coordinators, the instructor, or myself, and one of us will get in there and unlock that shift for you. It's real important though, you have to relock that shift in order for it to count. Even though FISDAP will automatically lock on you initially at 72 hours, if one of the instructors goes in and unlocks that shift, it will remain unlocked until you physically go in and lock it. So please make sure that you go in and lock that shift. That's pretty much this in a nutshell. At the end of the program, this entire report needs to be 100%. Everything needs to be green. And that will show that you've met your minimum competencies in order to complete the program. Hopefully that answers some of your questions. I will try and do another one of these again, but I will keep this link live and you should be able to access it at any time. So if you do have any questions, feel free to reach out to your instructor, the coordinators, or myself, and one of us should be able to answer your questions for you. Hope that works for everybody, and I will talk to you soon.